Good morning and good afternoon. I'm Anjana Singh from Central Department of Microbiology, Tribhuvan University, and also an academician, Nepal Academy of Science and Technology, NAST from Nepal. The title of my talk is Antimicrobial Resistance Pattern in Nepal, a brief review. First of all, I would like to thank for giving me an opportunity to present this in front of you all. When we talk about antimicrobial resistance, in short, we can say AMR. It's a serious threat to global public health, and it increases morbidity and mortality and is associated with high economic cost due to its health care burden. And multidrug-resistant bacteria also have substantial implications on clinical and economic outcomes. And antimicrobial stewardship, it's an organizational or system-wide healthcare strategy designed to promote, improve, monitor, and evaluate the rational use of antimicrobials to preserve their future effectiveness along with the promotion and protection of public health. So ASP has been very useful in promoting antimicrobials' appropriate use by implementing evidence-based interventions. So AMR, it has posed a major challenges facing public health in the country and has become threat to current and future medical advancements. Underdeveloped country like Nepal faces even bigger problem. It increases morbidity and mortality and is associated with high economic cost due to healthcare burden. And its drawbacks are due to lack of availability of reliable antimicrobial surveillance data, often the practical guidelines in the management of key infectious diseases in the developing world is hampered. And in AMR surveillance, antimicrobial susceptibility tests, in short AST, is of great importance to provide more effective therapy and minimize treatment failure. So there has been indiscriminate use of antibiotics leading to antibiotic resistance. So this has become because of the standard treatment guidelines that has not been available to the physicians or not following it. And in drug stores, antibiotics are available without prescription, accessible to substandard antibiotics, and inadequate monitoring, without prescription use of irrational self-administration of antibiotics. So what do we understand by antibiotic resistance? It's the unresponsiveness to the standard dose of antimicrobial agents, and there is some inherent resistance or acquired resistance development, and resistance can be slow to reverse or irreversible, which can be developed through gene mutation or plasmid exchange between same species of bacteria. And antimicrobial agents can select drug-resistant subpopulation of microorganisms. So what is the importance of AMR surveillance? Antibiotics are used as therapeutic agents for life-threatening purposes. However, emergence of drug resistance have limited the use. So there is need for newer drugs, which is of course costly. And in vitro AST testing is to find out the efficacy and to find out the drug sensitivity and therapeutic use. So when we talk of importance of AMR reporting, it's because the selection of pragmatic therapy at the local level is essential. Assessing the development of resistance problem at the national and international levels, and monitoring resistance frequency. detecting the spread of new resistance types and new emergence of the antibiotic resistance. So AMR surveillance activities are like characterization of disease etiological agents and resistance pattern, rapid identification and investigation of new resistance development, help the policy makers guidance in developing therapy recommendations, guidance to public health authorities in responding to outbreaks, evaluation of the impact of therapy and infection control interventions on infection and cure rates, strengthening laboratory capacity development. Now, when we talk of AMR surveillance in Nepal, it has started in 1999, where technical assistance has been provided by International Center for Diarrheal Disease Research Bangladesh, Dhaka, in short ICDDRB, and Nepal Public Health Laboratory, NPHL, which has become the focal point. And since 1999 to 2003, technical assistance has been given by ICDDRB, and financial support was given by USAID. Similarly, in 2004 to 5, technical assistance has been taken care by NPHL from Nepal, and financial support has been provided by USAID. So from 2006 onwards, technical assistance is taken by NPHL and financial support was given by WHO. So in Nepal, few of the strains of bacterial organisms has been monitored. For example, diarrheal diseases like Vibrio cholerae and Shigella species. Respiratory infections like organisms, Streptococcus pneumoniae, and Haemophilus influenza. And some of the multidrug urinary tract infection organisms, ESBL, E. coli, since 2009 it's been included, and sexually transmitted diseases or infections like Neisseria gonorrhoeae and typhoid fever like MDR salmonella species, which has been included from 2002. Altogether, there are 11 well-established laboratories within the country which was included in this study of an AMR surveillance. Now, when we talk of status of antimicrobial resistance in Nepal, like for example, if we take Vibrio cholerae, the change in serovar occurred from Ogawa to Inaba. For example, here you can see that from 2003 to 4, Ogawa strain was there. That is the serovar of Vibrio cholerae. And 5 to 6, it is again Inaba. And again in 7, it is Ogawa as well as Inaba and Hikojima also. And in 2008 to 10, again Ogawa. So the antibiotic susceptibility pattern we can see here in the table is that almost all of the antibiotics has been developing resistance except ceftriaxone, which is still 100% sensitive. Similarly, the next organism, Shigella vaccinari and Shigella dysentery, it has developed the resistance pattern as follows, where we can see that amoxicillin, nalidixic acid, cotrimoxazole, mesalamine, ciprofloxacin, azithromycin, these has developed resistance, and the percentage is given to the extreme right. And ofloxacin and ceftriaxone, it is still sensitive. In case of Streptococcus pneumoniae, we can see that most of the time, it's been seen highest in children less than 15 years of age and in also the old age group. So here, almost 6 of the antibiotics has shown resistance, while ofloxacin and ceftriaxone is still sensitive. In case of Haemophilus influenza, here we can see that almost all of the antibiotics which has been tested has shown resistance. And in case of STI, that is Neisseria gonorrhoeae, we can see here that 3 of the antibiotics, nalidixic acid, ciprofloxacin, ampicillin, they are resistant, while penicillin, tetracycline, azithromycin, and ceftriaxone is still sensitive. In case of multidrug-resistant Salmonella species, nalidixic acid is being seen as resistance, and ciprofloxacin, ceftriaxone, ofloxacin, chloramphenicol, azithromycin are sensitive. In case of ESBL E. coli, we can see that almost all of the antibiotics are resistant with high percentage. But however, there is still sensitive drugs are there where we can go for a combination of cefopodomazine, ceftazidime, cefotaxime. When combined with gluvanic acid, it becomes sensitive. And imipenem and meropenem, these are also sensitive against ESBL E. coli. So when we talk of stewardship, the National Antimicrobial Resistance Containment Action Plan, Nepal, in 2016, they have produced from the Ministry of Health in Nepal, where Action 7 and Action 8, it covers this antibiotic resistance pattern and how it can be developed or monitored for the betterment of the human health. So in this case, optimize the use of antibiotics in human health, animal health, and food processing has been taken care with the Ministry of Health and Department of Drug Administration and Department of Livestock. They are involved to regulate antibiotics, for example, prescription, use and sales at different levels of health system, including private sectors. And in case of Action 8, the Legislation Act policy to regulate non-therapeutic use of antibiotics in animals, food, animal feed, and agricultural sector has been also promulgated. So, in the end, the increased indiscriminate use of antibiotics, even during this COVID-19 pandemic, it will heighten bacterial resistance and ultimately lead to more deaths in future. Thus, this review highlights AMR scale and consequences, the importance and implications of an antimicrobial stewardship program to fight resistance and protect global health. Thus, the One Health approach, a holistic and multi-sectorial approach, is also needed to address AMR's rising threat. AMS practices, principles, and interventions are critical steps towards containing and mitigating AMR. So, evidence-based policies must guide the One Health approach, vaccination protocols, health professionals, education, and the public's awareness about AMR. So with this, I would like to end my presentation. Thank you for your kind attention.